Hi, I'm Matthew. I'm an audiologist in Brighton and I have an independent practice here. Today I'm going to talk to you about a hearing test. So hearing tests, you'll come in, we'll take a case history. We will then take a look in your ear with a video otoscope so you can see the health of the ear canal and the eardrum. Following this, you'll go into our soundproof room. We'll put some headphones on and you'll have a button. And each time you hear a tone, you'll push the button. We'll do that across a variety of different frequencies from low to high. And then that will give us a graph of your hearing threshold. After that, we will do something called tympanometry, and that's just going to test the movement of the eardrum. So it's completely painless, and it gives us a good understanding of your hearing loss, what type of hearing loss you might have, for a full picture of your hearing health. Following that, it's also important to do some speech testing. So this allows us to test how you hear in the presence of background noise. Once we gather all those results together, we can talk through them and understand what's your best course of action. Sometimes it's just a case of storing your health, your hearing health at that point in time, and lets you monitor it going forward. In other cases, maybe we could offer some hearing aids to help, or maybe discuss other solutions for you.